morning, friends. Today we will talk about anatomy of duodenum and pancreas. Both of these organs are located at the junction of foregut and hindgut. Foregut derivatives, you know the derivatives of foregut are abdominal part of esophagus, then stomach, first part of duodenum, second part of duodenum up to opening of bile duct, and then the midgut derivatives start from second part of duodenum distal to the opening of the bile duct. So second part of duodenum is derived partly from foregut and partly from midgut. Then the third part of duodenum, fourth part of duodenum, jejunum, ileum, they are then the ascending colon, right 2/3 of transverse colon, they are derivative of midgut. And then the left 1/3 of transverse colon, sigmoid colon, they are derivatives of, and rectum and anal canal, they are derivatives of hindgut. So duodenum and pancreas, they are at the junction of foregut and midgut. Let us see first the duodenum. Duodenum is shortest, widest and most fixed part of small intestine. Distal to the duodenum, we have jejunum and ileum, which are part of small intestine. So this is the most fixed part. You know the alternating part of gut are fixed and mobile. So your stomach is mobile. It is hanging by two folds of peritoneum, that is lesser omentum, greater omentum, and duodenum is next, which is most of it is retroperitoneal. So most of the duodenum is retroperitoneal and fixed part. Near two ends, except near two ends where it is suspended by folds of peritoneum. Proximal 2.5 centimeter of first part is intraperitoneal. So the first part is 5 centimeter long and its proximal 2.5 centimeter is intraperitoneal. Above it is covered by lesser omentum and below there is greater omentum. And the terminal part of the end of the fourth ventricle, it is lying in the uppermost part of the mesentery. So these two ends are mobile and rest of the duodenum is retroperitoneal and fixed. And the duodenum extends from pylorus to the duodenojejunal flexor. So this is the extent of duodenum. Okay. Now see the location of the duodenum. Duodenum is located near the midline at the level of upper three lumbar vertebra, L1, L2 and L3. And simultaneously you can see the location of pancreas, which is in the concavity of the duodenum. You can see, and this I told you retroperitoneal structure. Both of them are retroperitoneal structure, most of them. So location upper three lumbar vertebra near the midline as far as their projection in relation to the 9 quadrants of the abdomen. You see, their duodenum is mainly occupying the umbilical quadrant above the umbilicus. You can see it is located above the umbilicus. A part is extending into the epigastrium and a part is in the left hypochondrium. So the referred pen of the foregut is to the epigastrium. The referred pen is in the epigastrium. Foregut's referred pen is in the epigastrium. So this is about the location of the duodenum. Now see the parts of duodenum. A part of foregut, what are its, and midgut, what are its part? See, let us see. Again you can see here that it is at the level of upper three lumbar vertebra L1, L2, L3. These are the bodies of 3 lumbar vertebra, and you can see it is very close to midline, the duodenum. First part of the duodenum, you can see it starts from pylorus, runs upward towards the right and backward, upward, backward and towards the right, and reach up to the superior duodenal flexor. From this flexor, it will take a turn. Flexor means there is a sharp acute turn from this side. So superior duodenal flexor. So this is the first part of the duodenum. It is 5 centimeter long, and its proximal 2.5 centimeter, I told you, is intraperitoneal and mobile, and the distal 2.5 centimeter is retroperitoneal and fixed. Now see the vertically running second part of the duodenum, which is 7.5 centimeter long, extending from the superior duodenal flexor to inferior duodenal flexor. This is vertically running part, and here is the opening of bile duct and junction of foregut and midgut. Then you can see the third part, which is horizontally running at the level of the L3 vertebra, almost near the lower border, reaching up to the lower border of the L3 vertebra. This is horizontally, transversely running third part of the duodenum, which start from the inferior duodenal flexor up to the fourth part of the duodenum. The fourth part of duodenum, and this third part is 10 centimeter long. Fourth part is 2.5 centimeter long. It runs upward and then little forward. And here it ends at the duodenojejunal flexor. From here the jejunum will start. So duodenojejunal flexor. So can you identify the parts of the duodenum? First part, second part vertically running, third part horizontally running, and fourth part again going upward and forward. So these are the parts of the duodenum. Let us once again revise the parts and shape of the duodenum. You have seen it is a C-shaped structure, and in the concavity of C lies the head of pancreas. Total length is 25 centimeter roundabout, and first part is 5 centimeters, second part 7.5 centimeter, third part 10 centimeter, and fourth is the shortest part, that is 2.5 centimeters. So it should be clear to you that the most of it is retroperitoneal, fixed, except at the two ends where it is little mobile structure. Now, what is shown here over here, now you see the duodenojejunal flexor. You concentrate on this point, that is duodenojejunal flexor here, and you can see this green color structure, which is known as ligament of Treats, or it is suspensory muscle of duodenum. Suspensory muscle of duodenum, you can see it start from this right crus of diaphragm near the esophageal opening in the diaphragm, and then it runs downward behind the pancreas, and it get attached to the duodenojejunal flexor, to fourth part of duodenum, and also to the adjacent third part of the duodenum. So third part duodenojejunal flexor and fourth part of duodenum. This suspensory ligament or suspensory muscle of duodenum is there, and which keep this duodenojejunal flexor, this angulated structure. Now, what is important about this ligament or muscle, that its upper part is having skeletal fibers, which is very close to the right crus of diaphragm, taking origin from here, right crus of diaphragm, and right crus of diaphragm is also skeletal muscle. This is also skeletal muscle, upper part. Middle part, which is dotted, shown over here, is elastic fibers. It contains elastic fibers. In lower part, which is near the duodenum, which contains the smooth muscle, duodenum also contains smooth muscle. So this part, lower part, it is also made up of smooth muscle fibers. So this is a structure which are having both in the upper part skeletal muscle fiber, elastic fibers in the middle part, and in the lower part this is smooth muscle, and it suspends the duodenojejunal flexor. Now see what is the shape. We have seen that the shape of the duodenum is C-shape, but it also depends on the length of the suspensory ligament. Suppose suspensory ligament is short, it will pull the duodenojejunal flexor upward, and the shape of the duodenum in that case will be U-shape. Suppose the suspensory ligament is long, the duodenojejunal flexor will be more downward, and then the shape of duodenum will be somewhat like L-shape. So its length also decide the shape of the duodenum. Now, because of the contraction of this suspensory muscle, it can narrow the angle of duodenojejunal flexor. If the fibers of the suspensory muscle are attached only on the duodenojejunal flexor and not supported by its attachment on the third and fourth part of the duodenum, then they can contract and can lead to the obstruction of the duodenum. So in some case, this angulation can lead to the obstruction of the duodenum. So this is about the ligament of Treves, or what is there is suspensory muscle of the duodenum. Now visceral relation, peritoneal relations we have seen that most of it is retroperitoneal. Visceral relations of the duodenum. So we'll see the different parts, visceral relation, anterior and posterior relation of first part of duodenum. Anterior relation of first and second part, if we will see, most of it is by liver. Anteriorly, the first part and the upper part of second part are covered by liver. So see here the anterior relation. See the first part of the duodenum in this diagram here, and in front of it there is gallbladder and quadrate lobe of liver. So quadrate lobe of liver and gallbladder are in anterior relation of first part of the duodenum, and posterior to the first part is the portal vein, bile duct and gastroduodenal artery. If you remember, this is the retroperitoneal, this is retroduodenal part of the portal vein. So posterior relation of first part, that is gastroduodenal artery, bile duct and portal vein. So these are the three posterior relations. So first part, anteriorly remember, it is liver, and to be particular, it is gallbladder and quadrate lobe of liver. And posterior relations, you already know the three structures, that is bile duct, hepatic artery, and posterior most is the portal vein. Now, anterior and posterior relations of second part. First we will see anterior and posterior relations, then we'll see the right and left, what are there located on the. Now second part of the duodenum, it is related to the gallbladder, right lobe of liver. You can see the transverse colon covering the second part from above downward, and transverse mesocolon is there, and in the lower part coils of small intestine are there and in anterior relation. So liver, colon, transverse colon and coils of small intestine. Now posterior relation of second part, vertically running part. See this vertically running part for the posterior relations. You can see the medial margin of the right kidney is related to the second part of the duodenum. Then right renal vessels are related to the second part of the duodenum. Then right margin of the right edge of the inferior vena cava. And we can see the lower part, lower end of the second part is related to even right psoas major muscle. So this is related to right kidney near the hilum. This strip of kidney near the hilum is related to the second part of the duodenum on right side. Now third part of the duodenum, which is transversely running part, you can see anterior relation are the superior mesenteric vessels, superior mesenteric artery and superior mesenteric vein, which are the blood vessels of the midgut. Then you can see they are embedded in the root of mesentery. You can see the root of mesentery, and the uppermost end of the root of mesentery is covering the duodenojejunal flexor to make it mobile. So you see the root of mesentery starting from duodenojejunal flexor, come to on the anterior surface of the third part of the duodenum, and in it lies the superior mesenteric artery and vein. So, and also the coils of jejunum are related to the anteriorly to the third part of the duodenum. Now, posterior relations of the third part of the duodenum, it is transversely running structure, will cross all the vertically running structures on the posterior abdominal wall, especially inferior vena cava, aorta. These are two major vertically running structure on the posterior abdominal wall. And on the right side of the inferior vena cava, you can see right psoas major, right ureter, right gonadal vessels arising from artery arising from the abdominal aorta. So, what are the structures related posteriorly from right to left are, you can see the right psoas major, right ureter, right gonadal vessels, inferior vena cava is related here, and the abdominal aorta with the origin of the inferior mesenteric artery. It is also a branch of inferior mesenteric arteries, branch of abdominal aorta, and these are the gonadal vessels. This is right gonadal vessel, this is left. It can be testicular or ovarian. So this is the relations. So what you have to remember, this horizontal third part is related to vertically running structure of the posterior abdominal wall. Anterior and posterior relations of fourth part you can see this is small fourth part, 2.5 centimeter, anteriorly related to transverse colon and transverse mesocolon. Second part is also anteriorly related to transverse colon and transverse mesocolon. And fourth part is related to transverse colon and transverse mesocolon. And posteriorly this fourth part lies over here where it is related to renal vessels on the left side. This is the inferior mesenteric vein where it is related posteriorly. Left sympathetic chain is related posteriorly, left gonadal vein and left psoas major. So this is the area where the fourth part of duodenum lies, and these are the posterior relations. Sympathetic chain, inferior mesenteric vein, renal vessels, and this is the gonadal vessel. This is related to left side. So these are the relations. Now see the relations. Head is having two surfaces, and we have this first part of the duodenum is having relations. I already told you. Now above the first part of the duodenum, we have seen the anterior and posterior relations of first part, second part, third part and fourth part. Now above the first part of the duodenum there is epiploic foramen. Epiploic foramen. What are the boundaries of epiploic foramen? Inferiorly it is first part of duodenum. Superiorly caudate process of liver. Anteriorly there are hepatic artery, portal vein and bile duct in free margin of the lesser omentum, and posteriorly there is inferior vena cava. So first part of the duodenum, above that there is important structure epiploic foramen which connect the greater sac with the lesser sac. Right? So this is a epiploic foramen. Inferior to the first part, what is there is head of pancreas here. So anterior and posterior relations we have seen. Anteriorly what was there is the liver, gallbladder and that, and posterior to the first part the relations hepatic artery, portal vein and bile duct we have seen, and inferior to that is pancreas. This is second part. Second part you can see medial is related to head of pancreas, laterally there is colic flexor of colon, right flexor of colon is there on this side, right side. On left side it is the head of pancreas. Third part dekhiye, above it is related to the pancreas. So first part, second part, third part, here they are related to pancreas. So we can see this relations of the duodenum. Now there is one MCQ. Let us try this MCQ after learning the relations of the duodenum. All of the following are related to anterior surface of left kidney. Left kidney, not right kidney. You have seen the second vertically running part of the duodenum is related to right kidney. Spleen, pancreas, duodenum and left colic flexor. So, you know the duodenum is nowhere related to left kidney, though the fourth part is related to renal vessels, but not the left kidney. So here answer is duodenum. Duodenum is related to right kidney, but not related to left kidney. These are some of the peritoneal recesses. If you have studied about the peritoneum, you might be knowing about the peritoneal recesses. These are the narrow spaces of the peritoneum, and where there can be herniation of the parts of gut in these small recesses. So in relation to the duodenum, we are having superior duodenal recess with its orifice inferiorly facing orifice. This is superior duodenal recess. This is inferior duodenal recess. Its orifice is facing upward. And this is here is the retroduodenal recess behind the fourth part of duodenum, and its orifice is facing towards the left side. And this is important recess, paraduodenal recess, and its orifice is facing towards right side, and in it lies the inferior mesenteric vein. Inferior mesenteric vein. And this is duodenojejunal recess. Its orifice is facing downwards and towards the right. And this is mesenterico-peritoneal recess, in which lies the superior mesenteric vessels. So if there is any herniation, they are present in not in all the individual, but in some percentage of individual they are present. And this paraduodenal recess, if a surgical approach is done for herniation in this recess, then the care should be taken that there is inferior mesenteric vein lying in this recess. So it is important anatomical point to remember. Now see the arterial supply of the duodenum. We have already seen that it develops from foregut and midgut both. So the blood supply will be artery of foregut and artery of midgut. You know the artery of foregut is celiac trunk and artery of midgut is superior mesenteric artery. So both of them will supply the respective part of the duodenum. From celiac trunk, you can see the superior pancreatico-duodenal. There is gastroduodenal artery, and then there is superior pancreatico-duodenal artery and right gastroepiploic. This gastroduodenal artery divide into right gastroepiploic and superior pancreatico-duodenal artery. So superior pancreatico-duodenal artery is ultimately a branch of celiac trunk, and inferior pancreatico-duodenal artery, which is a branch of superior mesenteric artery, which is a artery of midgut. So two main arteries supplying the duodenum are superior mesenteric artery from celiac trunk, pancreatico-duodenal artery from celiac trunk, and inferior pancreatico-duodenal artery from superior mesenteric artery. Beside this, the first part of duodenum, you can see, receive the blood supply from different other branches. This is right gastric artery. It gives duodenal branches to the first part of the duodenum. This is common hepatic artery, which gives supraduodenal artery to the duodenum. Common hepatic artery, it gives the duodenal branches to the duodenum. And this is the branch from the hepatic artery, right? You can see right gastroepiploic artery also supplies the first part of the duodenum. So these are additional supply to the first part of duodenum from right gastric, from right gastroepiploic, from hepatic artery, and even from the gastroduodenal artery. So all these arteries give additional blood supply to the first part of the duodenum, but the main blood supply is superior pancreatico-duodenal and inferior pancreatico-duodenal artery. So you can see the artery of foregut and artery of midgut, both are supplying the duodenum. Venous drainage, as far as venous drainage is concerned, the veins, you know the duodenum lies here, C-shaped duodenum surrounding the head of pancreas, and its vein will drain in the splenic vein or superior mesenteric vein or directly in the portal vein. So this is the venous drainage. How the portal vein is formed, you know, superior mesenteric vein and splenic vein and portal vein. So all these three, the tributaries from the duodenum drain in all these three veins. Remember, the nerve supply is sympathetic and parasympathetic nerve supply. Sympathetic is from the T6 to T9 segment of the spinal cord, and parasympathetic is from both vagus nerve. They form plexuses. There are nerve plexuses surrounding the celiac trunk and superior mesenteric artery. They are known as celiac and superior mesenteric plexuses. So sympathetic nerve and parasympathetic both reaches this celiac and superior mesenteric plexus, and along with the arteries arising from the celiac trunk and superior mesenteric artery, the nerve travel along the arteries and supply the duodenum. So sympathetic and parasympathetic. Sympathetic this T6 to T9 will travel with the splanchnic nerve to reach these plexuses. Sympathetic nerve, they are vasoconstrictor and inhibitory to duodenal musculature, while parasympathetic nerves are secretory to mucosa and motor to the duodenal musculature. They stimulate the parasympathetic. So this is about the nerve supply of the duodenum. Now let us see the applied aspects of the duodenum. And when you will see the diagram, that is you will go for the radiology of the duodenum after barium meal. You will see the plates of after barium meal. You will find that you can see the duodenal cave. After barium meal, first part of duodenum is seen as triangular shadow. We'll see that how it is seen. You can see this. This is the barium meal in stomach. Here is pyloric sphincter, and you can see this is duodenal cave, also called duodenal bulb. That is the first part of duodenum, which is smooth inside, and first 2.5 centimeter is forming this first duodenal cap. So you can see duodenal cap, and lower down you can see the second part of duodenum, third part of duodenum. So this is duodenal cave because the interior of it is having no mucosal fold. In the second fold part and third part there are mucosal folds. So you can see this furry appearance. But in first part it is a smooth. First 2.5 centimeter duodenal cave. You can see. What else is important? The first part of duodenum is prone to ulcers, especially the people which are having young people with lot of tension, they are prone to develop the duodenum, this ulcers in the first part of the duodenum, and this pain of this ulcer is relieved by meal. It can adhere to liver and gallbladder. If the first part of the duodenum is ulcerated, anteriorly it is related to the quadrate lobe of liver and gallbladder. So it can stick there, adhere there to the liver and gallbladder. And here the anterior relation of first part of duodenum are important. Suppose you see there are adherence of the first part of the anterior surface of first part of duodenum to liver and gallbladder. So ulcer can be there in the duodenum first part. Then third, what can be the other important aspect? It is stenosis of the duodenum or constrictions. You already know the contraction of suspensory muscles. I told you if it is attached only to the duodenojejunal flexor, it can cause this stenosis of the duodenum. Second, it can be congenital or annular pancreas can obstruct. The pancreas is surrounding we'll see this later on. The pancreas is surrounding the second part of the duodenum and obstructing the second part of the duodenum. So annular pancreas can obstruct second part. This can obstruct at the duodenojejunal junction, contraction of the suspensory muscle. So duodenal cap you have already seen. So this is about the duodenum. Now see the gross anatomy of pancreas. Pancreas. If you open the anterior abdominal wall and see the different organs, you cannot see the pancreas because it is anteriorly covered by many different visceras and lies on the posterior abdominal wall. It is on the posterior, very deeply placed structure. So pancreas, can you see it in the concavity of the duodenum and transversely placed structure? Pancreas is a gland in abdomen. It has two parts, exocrine part which secrete various enzyme and is responsible for the digestion of the carbohydrate, protein and fat. And for exocrine part, duct system is there. So there is well developed duct system in the pancreas. And endocrine part, that is the islets of Langerhans responsible for secretion of hormones, especially the most important one is insulin. So it is exocrine and endocrine, both the parts are there in pancreas. Now what are the parts of the pancreas? It is head, this expanded part which is in the concavity of the C from right to left. It is transversely placed. This structure is transversely placed on the posterior abdominal wall. Here there is duodenum. I will show you next slide. Here it is transversely placed. I will tell you location later on. See the parts first. What are the parts? Head. You can see on the right side. Then neck. This is body. Head is having one process, that is uncinate process. Body is having one process, tuber-omental. Upper border pe you will find one process, that is tuber-omental. And here is the tail of pancreas. So head with one process, uncinate process. Neck, constricted part is there between head and body is having one process, tuber-omental, and this is the tail of the pancreas. So these are the parts. Here you can see the location of pancreas. It is at the level of again L1, L2 vertebra. Duodenum was from L1, L2, L3 vertebra. It is located at the level of L1 and L2 vertebra and transversely placed organ on the posterior abdominal wall extending from the C-shaped curvature of the duodenum from right side to spleen on the left side, crossing all the structures on the posterior abdominal wall, transversely running structure. With uncinate process, head, neck, body and tail. This is tail which lies in the linorenal ligament. Linorenal ligament and is related to the splenic vessels at the hilum of the spleen. And here this tail part is especially rich in islets of Langerhans, and this care should be taken during splenectomy. This part should be preserved, otherwise along with the spleen, if this part of duodenum is dissected out, it can cause cavities mellitus because islets of Langerhans are removed and it lies in linorenal ligaments. You will study in spleen, there are gastrosplenic and linorenal ligament at hilum. These are two folds of peritoneum, and this lino means kidney. Lino means spleen and renal means kidney. So linorenal ligament is there. So I told you again, I will emphasize that this pancreas is transversely placed on posterior abdominal wall. Now here, please carefully listen this thing. It is behind the stomach, separated from stomach by lesser sac. There are two peritoneal sacs, greater sac, and this is lesser sac which lies behind the lesser omentum, behind the stomach, and also extend into the greater omentum. This is lesser sac, the small sac of peritoneum, lesser sac. And here is our pancreas, you can see. So the pancreas is anteriorly, there is stomach, then lesser sac, so you have to displace all this to see the pancreas. So transversely placed on the posterior abdominal wall behind the stomach, separated from it by the lesser sac. Very important relation is this, because by this you will be able to remember the many relations, anterior relations of the pancreas. See what are the size, shape, dimensions of pancreas. J-shaped structure, the curved part of J is on the right side, head, and this is represented by uncinate process, this curve of J. 15 to 20 centimeter long, 2.5 to 3.8 centimeter broad, 1.5 to 1.8 centimeter thick, and weighs about 90 grams. So these are the dimensions of the pancreas. Now we'll see the relations of various parts of the pancreas, but first I will like to tell you the various borders of the various parts. Now this is head. Head is having superior border, this is the right border, and this is the inferior border. I will tell you all these relations together. This head of pancreas. Again, I will revise: superior border of head of pancreas, right lateral border of head of pancreas, inferior border of pancreas, head of pancreas. So this is head, this is anterior surface, and behind there is posterior. So 3 margins and 2 surfaces, anterior and posterior. So we'll like to see the relations of 3 margin by this blood supply of the pancreas very easily by this diagram. If you remember this diagram, you can remember the relations of the 3 borders of the pancreas. The upper border is related to the, you can see the first part of the duodenum, right lateral border to the second part, and the inferior border is related to third part of the duodenum. This first part of the duodenum overlaps the head of the pancreas. As far as arteries are concerned, superior pancreatico-duodenal artery along the upper border, inferior pancreatico-duodenal artery along the lower border of the head, and along the right lateral border there is anastomosis between the superior pancreatico-duodenal and inferior pancreatico-duodenal arteries. Now you can see other structures relations also here. This is the body, this is the upper border of the body. Here is tuberomental. So above the tuberomental there is celiac trunk, and you know the branches of celiac trunk. This is hepatic artery, this is splenic artery. So celiac, upper border of body is related to celiac trunk tuberomental. Then this is a splenic artery on the upper border. Here is hepatic artery on the upper border of this. And lower border of body, in this diagram you can see there is superior mesenteric artery at the right end of lower border. This is uncinate process. You can see uncinate process anteriorly related to superior mesenteric artery, and this third part of duodenum is also anteriorly crossed by the superior mesenteric vessels. Right? So this is superior mesenteric artery. Uncinate process relations. So here most of the relations of the most of the borders of the pancreas you can see. Now the relations of head, surfaces, we can see surfaces. We already seen the borders of this. These 3 borders of the head of the pancreas. Now see the relations of the surfaces. Anterior surface of pancreas, head of pancreas, there is transverse colon, transverse mesocolon. Right? This is transverse mesocolon. The root of transverse mesocolon is attached here on the anterior border of pancreas. I will tell you this. And what is the relation of this? Even the jejunum is related to the anterior surface, and anterior surface of uncinate process. Remember, this is superior mesenteric vessels which are anteriorly related to the uncinate process. Right? This is uncinate process. Posterior relation, you can see head, behind the head there is bile duct and inferior vena cava. यहाँ पर inferior vena cava रहेगा behind the head, and bile duct will come here to get open in this second part of the duodenum. So it is related here. Now here is the neck of pancreas. Neck of pancreas. And in this diagram we can see the relation. Don't forget this important relation, that is the formation of portal vein is on the posterior surface of neck of pancreas by the union of the splenic and superior mesenteric vein. So most important relation of the posterior surface of the neck of pancreas is formation of portal vein. So this is posterior relation. Let us see the anterior relation of the neck of pancreas. Anterior relation. I told you the anteriorly stomach is related to pancreas, separated by lesser sac. So the neck anteriorly is related to pylorus of the stomach. Neck, anterior to the neck there is pylorus, and anterior to the body the first part of duodenum. First part of duodenum. So stomach, you can see, is anteriorly related. Of course it is separated by lesser sac. So which part of the stomach is there anterior to the neck is pylorus. Pylorus. And this is first part of the duodenum anterior to the head. और head में आपने दूसरे relations देखे, transverse colon, and this is jejunum. So jejunum, one tube, this is second tube, that is transverse colon, and here is the third tube, this is overlapped by the first part of the duodenum. So 3 tubes are related to the anterior surface of the head, and posteriorly inferior vena cava and bile duct. So these are the relations of head and neck. In this diagram you can see the relations of uncinate process. I told you anteriorly the uncinate process is related to superior mesenteric vessels. Here you can see even its posterior relations. Uncinate process anteriorly is related to the superior mesenteric vessel, and posterior to uncinate process there is aorta. Posterior to the head there is inferior vena cava. Posterior to neck there is portal vein. So remember this three vertically running structure from right to left: inferior vena cava, portal vein, and aorta. This is posterior relation of head. This is posterior relation of neck. And this is posterior relation of uncinate process. This lies posterior to the uncinate process. Even you can see the body of the pancreas anteriorly is related to anterior surface of the pancreas. Body of pancreas is related to stomach. Stomach is anterior to the body, and lesser sac separated by lesser sac. So when I will tell you about the relations of the anterior surface of the body of pancreas, it is stomach and separated by lesser sac. So come to the relations of the, again you can see uncinate process relation, very important, anteriorly related to the superior mesenteric, posteriorly you can see aorta is there. Body, if you see the this cross section of the body there, it is triangular with three borders and three surfaces. This is superior border, anterior border, inferior border. This is anterior surface, inferior surface, and posterior surface. I told you pancreas is retroperitoneal, so this anterior and inferior surface are covered by peritoneum. Posterior surface is not covered by peritoneum. It is retroperitoneal organ only. Anteriorly at some places it is covered by peritoneum. Posterior surface is not covered by peritoneum. Such organs are called retroperitoneal organ. So this is peritoneal relation of body. Now see the relations of various borders. Abhi aapko already you will be able to say the relations of the borders. Upper border, you remember that celiac trunk, splenic artery, hepatic artery. I have shown you that diagram. Inferior border, you can see again on the right end of inferior border superior mesenteric vessels, but one important anterior border. Anterior border, it gives attachment to the root of transverse mesocolon. Transverse colon is having a mesocolon that is transverse, fold of peritoneum that is transverse mesocolon. So it is attached to the anterior border of body of pancreas and extending even onto the head of pancreas, or either say second part of duodenum. Even it is reaching up to the second part of duodenum. So this is root of transverse meso. Here there is second part of duodenum. So the borders, three borders, superior, inferior, and this is the anterior border. So remember, anterior border gives attachment to transverse mesocolon. Now the surfaces, in this diagram we can see the anterior surface and this is the inferior surface. Anterior surface looks forward and upward, and I told you what is the relation? Stomach separated by lesser sac. Again I will like to show you that diagram where anteriorly there is stomach and covering, separated from pancreas by the lesser sac. So this is the anterior surface. Itna hi relation hai stomach and lesser sac. This is inferior surface. You can see again the three tubes, that is duodenojejunal flexor, coils of jejunum, and this is the transverse colon and left colic flexor. Splenic flexor of colon. This is splenic or left colic flexor. So these three tubes are related to this inferior surface, which is covered by peritoneum. This surface is also covered by peritoneum, right? And can you identify all the structures in this diagram? Now see the posterior relations of body. Remember, body is triangular in shape, cross section, and posterior surface flat, extending from superior border to inferior border and not covered by peritoneum. This is the posterior surface, and from right to left body की अगर बात करें यहाँ तक uncinate process, it is related to the aorta with the origin of superior mesenteric artery. You can see one important structure on posterior surface. This is a splenic vein. Where was the splenic artery? Upper border. So remember the splenic artery, which is a tortuous artery. Again, I will like to show you the splenic artery. This you can see a tortuous artery on the upper border of the pancreas. Why it is tortuous? To allow the movement of the spleen during respiration. So this is tortuous artery. And where is the splenic vein? It is not with splenic artery, not on the upper border of the body of pancreas, but where it is, what we were talking about, posterior surface, relations of the body of the posterior surface. Here you can see the splenic vein. Right? So splenic vein, then what will be here? Renal vessels. This is left kidney. Left kidney is related to the body of pancreas, and tail lie in the linorenal ligament, I told you. So transversely the body, these are the relations of the body, but don't forget there is a splenic vein on posterior surface. I will like to show you one more diagram for the posterior relations of all the parts of the pancreas. Remember, from right to left, behind the head there is inferior vena cava, behind the neck portal vein, not shown in this diagram, behind the uncinate process aorta, behind the body aorta with superior mesenteric artery. This is the origin of the superior mesenteric artery. It is posteriorly related to the body. Then even you can see in this diagram the left crus of diaphragm, renal vessels you can see, the kidney, left kidney is related to this, and along the upper border, this tortuous artery is the splenic artery. So these are the posterior relations of the. Again, we can just revise you can see this diagram and can revise the location. Everything is there in this diagram, various parts, and you can see from right kidney to left kidney, all the transversely lying structure. You can see the duodenum is related to right kidney, but not to left kidney. You can see the body of pancreas is related to left kidney, and this is the spleen where the tail of pancreas reaches up to this. What is this? Is uncinate process. I think you can identify all this structure. You can identify the three major branches of the celiac trunk: hepatic artery, left gastric artery, splenic artery. This is celiac trunk, artery of foregut, rises at the level of disc between T12 and L1 vertebra, anterior branch of the abdominal, ventral branch of the abdominal aorta. Arterial supply, indirectly we have seen already the blood supply of the, while we were talking about the relations, splenic artery, major blood supply to many branches are given, pancreatic branches are given by these are the pancreatic branches given by the splenic artery, while it is traversing along the upper border of the pancreas. But one of the branch of the splenic artery, you can see arteria pancreatica magna, which is large one, and it is called arteria pancreatica magna. This is hepatic artery, gastroduodenal artery, superior pancreaticoduodenal and inferior pancreatic. So main blood supply is by the splenic artery, superior pancreaticoduodenal, inferior pancreaticoduodenal. They supply the blood artery to arterial supply. Venous drainage, splenic vein, this is superior mesenteric vein and portal vein. This is the venous drainage of the nerve supply, sympathetic nerve supply and parasympathetic nerve supply. It is through the plexuses around the arteries, that is celiac plexus and superior mesenteric plexus, and supplied by the branches of the arteries. And sympathetic is vasoconstrictor, parasympathetic control the secretion. This is having the influence on the control of secretion of the pancreas, parasympathetic part. Stimulate the secretion of the pancreas. Now, interior of pancreas, there are mucosal folds in the interior of pancreas, except the first part. In second part, we can see the mucosal folds of the pancreas. If we see the interior, what we will see among these mucosal folds, that is major duodenal papilla is an elevation 8 to 10 centimeter distal to the pylorus. I will show you this diagram posteromedially. You can see here, these are the mucosal folds, transversely running mucosal folds are there, and here you can see the two openings. This is major duodenal papilla, and this which is 8 to 10 centimeter from pylorus, and this is 6 to 8 centimeter, 2 centimeter proximal to the major duodenal papilla is minor duodenal papilla. So these are the opening of the ducts. I will talk about that later. So you can see the mucosal fold in the interior and the opening, two major opening in the second part of the duodenum. So major duodenal papilla, pancreatic ampulla open in the summit. Minor duodenal papilla is 6 to 8 centimeter from the pylorus, and at the minor duodenal papilla, accessory pancreatic duct will open at its summit. Or major per hepatopancreatic ampulla open at its summit, which contain bile duct and hepatic duct and pancreatic duct both. Main pancreatic duct. We'll see this later on. What else are there? So this is the duct system of the pancreas. Now we'll also see in short the development of pancreas to understand this duct system of the pancreas. Now first we'll see what are these structures. Head, uncinate process, and parts of pancreas, duodenum you can identify. Now what is this? Is the main pancreatic duct. You can see this is the main extending from the tail, body of horizontally coming near the neck, it turns downward and goes towards the posteromedially, and in the opening at the major duodenal papilla. Here is the opening. Here there is dilatation known as ampulla of Wetter, and you can see the bile duct is also opening through the same opening. So bile duct and major pancreatic duct, also known as duct of Wirsung. This is also, and you can see the tributaries of the duct in herringbone pattern. The tributaries are in the form of, at an acute angle, V-shaped manner. You can see they are in the V-shaped manner. This is herringbone pattern is seen in the, and this duct system is more close to the posterior surface. So if you want to dissect the duct system, this major pancreatic, main pancreatic duct, you should approach from posterior surface. You can see we'll remove some of the acinine structure of the pancreas with forceps, and you will come across the grayish white structure. This close to the posterior surface is the main pancreatic duct. And here you can see the accessory pancreatic duct from the uncinate process and lower part of the head, which open at the minor duodenal papilla proximally. And this major duodenal papilla is the junction of the foregut and midgut. Here. Above this is foregut, below this is midgut. This is the site of this. In short, this is the dorsal pancreatic bud and ventral pancreatic bud. This is bile duct or hepatic duct, and the pancreas grows from two sources. This is dorsal pancreatic. Ventral pancreatic duct is initially bilobed. It is bilobed, not shown over here. Then it unites to form a single ventral pancreatic bud, and then due to the rotation of the second part of the duodenum, this duct will cross the duodenum, second part of the duodenum from posterior side, and will come to lie below the dorsal pancreatic duct. Both of them fuse, and you can see the uncinate process and lower part of head is derived from the ventral pancreatic bud, and rest of the part of this pancreas develop from the dorsal pancreatic bud. So pancreas development, uncinate process and lower part of head, and this is rest of the part of pancreas develop from here. This is major duodenal papilla, minor duodenal. Again, these two ducts, you can see the duct system is like this, a minor ventral pancreatic bud, and this is dorsal pancreatic bud. Now there is anastomosis between the two ducts. You can see the main pancreatic duct and accessory pancreatic duct. This is main pancreatic duct, this is accessory pancreatic duct. And there is anastomosis between the two ducts, and in such a way that this main duct, the proximal part of the main duct, will form the accessory duct of the pancreas, and this the duct of the ventral bud will form the main pancreatic duct. So this is main pancreatic duct. This part is derived from ventral bud, and this part is derived from the duct of dorsal bud. So this is I told you the ventral bud is initially bilobed and then it unite to form single lobe. But if it is not fused, both the lobes of ventral bud do not fuse, they can form, when there is rotation, they can form they are arranged in a circular annular fashion around the second part of duodenum. You can see in this diagram, and can cause the stenosis of the second part of the duodenum. This is developmental anomaly. What is the other applied aspect? You know, the diabetes mellitus is the endocrine part of the pancreas, is responsible for secretion of insulin. Acute pancreatitis is can cause pseudopancreatic cyst. Yes, here I will like to your attention for this, that pseudopancreatic cyst. What it is? Due to acute pancreatitis, there is collection of fluid in lesser sac, and that's why repeatedly I was telling you that anterior surface is related to the stomach and separated from stomach by lesser sac. Due to inflammation of pancreas, acute inflammation, there can be fluid collection in the lesser sac, and that gives an impression that there is cyst in pancreas, but it is the collection of fluid in lesser sac, and it is called pseudopancreatic. Pseudo means not true. Pseudopancreatic cyst. Let us see the diagram for pseudopancreatic cyst. Again, you can see here vertebral column. This is pancreas. This is lesser sac here, and stomach. Between the pancreas and stomach, there is lesser sac. Collection of fluid in the lesser sac. This lead to the pseudopancreatic cyst. Like this, it can be communicating with the duct system. It can be non-communicating type of pseudopancreatic cyst. So this, by pseudopancreatic cyst, you can remember that anterior surface is related to the lesser sac. Carcinoma of head of pancreas is it can praise the important structures related to head. Posteriorly, there is bile duct. If bile duct get compressed because of the carcinoma, it can lead to obstructive jaundice. And posterior to the neck, there is portal vein. If it get obstructed by carcinoma, can lead to ascites. And anterior to the neck, there is pylorus, and if it get compressed, gastric stasis can be there. So all these anatomical relations of the pancreas are important. Pseudopancreatic cyst you have seen. Okay, I will like to acknowledge for this presentation textbook of, thank you to this sources, that is textbook of anatomy by Dr. Vishram Singh and B.D. Chaurasia, and rest others I have mentioned here. So, thank you so much.